Good morning.
Good morning.
At this time, please begin the live stream of this meeting. The board meeting of the North Carolina Board of Nursing will now convene. We have a quorum for the meeting. This is an official meeting of the North Carolina Board of Nursing being conducted in accordance with North Carolina's open meeting law under Article 33C, Chapter 143 of the North Carolina General Statutes. The board recognizes the public's right to attend and observe this meeting. As such, this meeting is being streamed on the board's YouTube channel as well as being recorded. The board's mission, vision, and values drive our work as a board and serve as a reminder to us as we carry out our business. The mission of the board is to protect the public by regulating the practice of nursing. Our vision is exemplary nursing care for all. In pursuit of our mission and vision, we focus on three core values: equity, we are committed to fairness and justice; integrity, we act in good faith in protecting the public; and agility, we are responsive to emerging healthcare trends. And for the board members who are following, we're at M2 of your packet. In accordance with the State Ethics Act and the Code of Conduct for members of the North Carolina Board of Nursing, it is the duty of every member to avoid both conflicts of interest and appearances of conflict. Does any member have any known conflict of interest or appearance of conflict with respect to any matters coming before the board today? If so, please identify the conflict or appearance of conflict and refrain from any undue participation in the particular matter involved.
Madam Chair, I am recusing myself from consent agenda item 6C, Galen College of Nursing, and will complete the appropriate recusal form.
Thank you, Dr. Barlett.
Madam Chair, I, Dr. Kistler, will be recusing myself from agenda item C6, specific to the items related to Catawba Valley Community College and completing the required documents.
And thank you, Dr. Kistler. So again, welcome all board members. Welcome to our guests who are observing today in the office and on our YouTube channel. Are there any other announcements at this time? We will move on to M4 of your agenda packet. Are there any additions, modifications, or reordering requested at this time? Okay, we will move on to M5 of your agenda packet. Do I have a motion regarding adoption of the consent agenda?
Madam Chair, I move we accept the consent agenda.
Thank you, Diane Layton has made a motion to adopt the consent agenda. Do I have a second? Dr. Amy Steele has seconded the motion. At this time, I will call for a vote. All in favor by a show of hands. All right, and the motion carries. M6 of your agenda. Do I have a motion regarding adoption of the meeting agenda? All right, Dr. Ingram has made the motion to adopt the meeting agenda. Do I have a second? Andrea Jepson has seconded the motion. I will now call for a vote. All in favor by a show of hands. And the motion carry. We now, at this time, will proceed to the open comment period. The purpose of the open comment period is to provide the public an opportunity to share their concerns, offer views, and present questions regarding issues that impact nursing and nursing regulation. We are prohibited from discussing specific cases which are either pending or under investigation by board staff or other administrative agencies regarding the conduct or failure to act in a manner that could possibly be a violation of the Nursing Practice Act. Accordingly, we ask that no one ask to discuss the case of a licensee that is currently under investigation, scheduled for hearing, or may come under consideration by the board as doing so may tend to jeopardize the licensee's ability to have a fair and impartial hearing before the board as provided for and required by law. Individuals, we have 5 minutes each to address the board. Any written statements or materials related to your presentation may be left with the administrative coordinator for distribution to board members. Is there anyone at this time that would like to speak? Okay. Thank you. At this time, I will call Ms. Jane Morrow. Good morning, Ms. Morrow. And if you could, hit this, yes, so we can hear you. Thank you.
Okay. Good morning and thank you. I'm a registered nurse from Weaverville, North Carolina, and I have done volunteer work and presented workshops on domestic violence, and I'm going to go on into my topic. The North Carolina Coalition Against Domestic Violence acknowledges that domestic violence is an epidemic and that impacts people in all communities, regardless of gender, age, race, sexual orientation, economic status, or religion. Domestic violence is an equal opportunity destroyer. In North Carolina, more than 35% of women and 30% of men experience domestic violence and/or stalking in their lifetime. The U.S. Department of Justice defines domestic violence as a pattern of abusive behavior in any relationship that is used by one partner to gain or maintain power and control over another intimate partner. Domestic violence can be physical, sexual, economic, psychological, and/or technological actions or threats of actions or other patterns of coercive behavior that influence another person within an intimate partner relationship. This includes any behaviors that intimidate, manipulate, humiliate, isolate, frighten, terrorize, coerce, threaten, blame, hurt, injure, and/or wound someone. According to the National Domestic Violence Hotline, close to half of all women and men experience psychological aggression abuse by an intimate partner in their lifetime. Psychological aggression often escalates to physical violence. Love is Respect reports that 1 in 3 teens is in a violent dating relationship, and 43% of college women report violent or abusive relationships. The Centers for Disease Control regards domestic violence as a significant public health issue. Health problems may include physical injuries, adverse medical conditions affecting many systems of the body, substance abuse, and/or mental health problems. These conditions often become chronic. Domestic violence can be fatal. A 2023 article on domestic violence in Stat Pearls points out that 50% of women seen in emergency departments report a history of abuse, and approximately 40% of those killed by their abuser sought help in the 2 years before death. The October 19, 2022 issue of the British Medical Journal reports that women in the United States are more likely to be murdered by an intimate partner during pregnancy or soon after childbirth than to die from the 3 leading obstetric causes of maternal mortality: hypertensive disorders, hemorrhage, or sepsis. The American Association of Colleges of Nursing recognizes domestic violence as a special form of violence requiring healthcare interventions. They recommend that curricula in educational institutions preparing nurses in baccalaureate and higher degree programs contain factual information and clinical experience regarding domestic violence, including acknowledgement of the scope of the problem, assessment skills to identify and document abuse and its health effects, interventions to reduce vulnerability and increase safety, competence in recognizing how cultural factors influence the patterns of and responses to domestic violence in individuals, families, and communities, legal and ethical issues in treating and reporting domestic violence prevention. Nurses will likely encounter victims of domestic violence in any and every geographical, and clinical setting in which they practice. A nurse may be the first health care professional a victim encounters. In light of this, I would suggest that all nurses and LPNs, associate degree, bachelors, and beyond have domestic violence education. Well, nurses practicing in North Carolina know how to interact with and care for survivors of domestic violence in manners that enhance the safety, health, and well-being of the survivors and their families. The answer depends on you, the Board of Nursing. You have the power to help end domestic violence and promote the safety, health, and well-being of survivors by ensuring that all nurses, educated and/or licensed in the state of North Carolina, receive mandatory domestic violence education. Thank you.
Thank you, Ms. Morrow. Thank you for speaking to the board today. All the comments presented will be taken under consideration by the board. Is there anyone else who would like to address the board? Thank you. This concludes the open comment period. At this time, I will turn the meeting over to Ms. Angela Ellis for the elections of the officers. Ms. Ellis?
Good morning, everyone. First off, I'd like to recognize the members of this year's nominating committee, Andrea Jepson, Dr. Carmen Shaw, and Tom Minowitz. I'd also like to recognize the staff liaison, Chandra Graves, the manager of administration, who handles all the activities with the committee. On behalf of the nominating committee, I'm pleased to present the 2025 slate of candidates for the NC Board of Nursing Chair and Vice Chair. For Chair, our nominees are Dr. Raquel Ingram, RN, Andrea Jetson, LPN. For Vice Chair, Ms. Diane Layden, Public Member, Arlene Imes, LPN, and Tom Minowitz, Public Member. In accordance with the nominating committee procedures, the board may accept nominations from the floor. And at this time, I'd like to ask if there are any further nominations at this time. Okay, seeing none. Madam Chair, on behalf of the nominating committee, I move the board accept the slate of candidates for chair and vice chair as outlined in agenda item M7.
Thank you, Ms. Ellis. Do I have a second? Okay, okay. That's a committee recommendation, so we
Yes,
don't
ma'am.
need a second. Okay, and now I will call for a vote. All in favor, by show of hands. Okay. The motion carries, Ms. Ellis.
At this time, I'd like to recognize each of the candidates, nominees, to present remarks to the board if they so wish. So first, I will recognize Chair Candidate Dr. Raquel Ingram.
Things that have been listed about me. We are on page 4, but I am running for chair. I just want to thank you in advance for your consideration. As you may already know, I love the work of the board. I love being a nurse. That's what I do. I can't imagine doing anything else. I'm always working in support of the board, the mission of the board, whether it's doing the work of the North Carolina Board of Nursing or in my current role as founding dean of the School of Nursing at High Point University. I know sometimes I'm considered a workaholic, but it's good work. And I think that it's really good to be able to do what you love and then you get paid for it. Not here, but you get paid for it. In terms of my leadership, again, hoping that you have the chance to skim over some of the things that I have done in terms of my profile, but just some more recent opportunities that I'm involved in is I am an NLN National League for Nursing participant along with Brooke and I. So enjoying that. My leadership style I'm a transformational leader, and I love inclusivity. And with inclusivity, I think that everybody should have the opportunity to know what's going on so that we can make informed decisions here at the board. We make some very important decisions, and so it is my I believe that we should always be informed. So that's why you hear me answering or asking a lot of questions. Sometimes I know the answer already, hint, hint. But I think everybody should know the answers to that. So also, I appreciate the different perspectives that we all bring. Our public members, current nursing peers, we all have different backgrounds. And so I really like when we sometimes disagree, and it allows, I'm an educator, and so it allows us to hear the different perspectives and moments for educational opportunities so that we can come together and make that decision. A few uniques about me, and I know my time is running out, but I already mentioned that I'm the founding dean of nursing at High Point University. This is my third program. So in my opportunities, I've had the opportunity to start 3 North Carolina-based nursing programs. With one of those, with my workaholic background, I had a very generous donor. So if you missed me yesterday, I was speaking on about the generous donor. We can talk about what that generosity is later after this, but I believe that my hard work and my passion for nursing and for serving on the board has paid off. Thank you.
This time I recognize Chair nominee Andrea Jetson.
Good morning. I am actually finishing up my 5th year of being on the board and have thoroughly enjoyed it. I have learned a lot. Being sitting on the different committees and have chaired committees, you actually learn how the board functions, from education to how your investigators investigate, and our law office. Some of the things that we think we can do, they say, that's not what we're here. We're going to do, we have to eyeball this one. I just think that we're just a big one unity family, that we all come together and make the decisions of the board. It's just very important that we protect the public and we protect our patients. All of us are big advocates of our patients. We love them. Otherwise, we wouldn't be nurses. I do have a more clinical background of being on the board than some, and I think that would bring a lot to the board, that I could actually understand where some of the licensees, I won't say where they're coming from because of different reasons, but I think that I would make a great difference, and I would just appreciate for your vote. Thank you.
At this time, I'd like to recognize our vice chair nominee, Ms. Diane Layden.
Yes, good morning, everybody. I am finishing up my 4th year now here on the board, and I have been reappointed for 4 more. I'm sorry for y'all, but anyway. So I'm running for vice chair because I know I can make a difference, especially being a public member. I come from a totally different perspective. I also came onto the board originally already a seasoned regulator, having served for 6 years on the North Carolina Board of Massage Bodywork Therapy as a public member, and also on the Federation of State Massage Therapy Boards, their board of directors. I try to always come prepared for our meetings. Doesn't matter if I'm just a member or if I'm the chair of the committee. I'm also a networker, and I know y'all know I love to meet people, and I love to introduce people to each other, because that way we can accomplish so much more. And even like when new members, I'll say, okay, we're downstairs having supper, y'all come join us. So you get to know the board that way too. I think it's important that the new members feel as a part of the whole. So I pledge support of whomever becomes the chair and the board's mission, visions, and values. So please consider me, Diane Layden, for vice chair. Thank you very much.
At this time, I'd like to recognize the nominee for vice chair, Arlene Imes.
Good morning, everyone. I'm honored to have the opportunity to be here today, seeking the position of vice chair. If given the opportunity to serve as your vice chair, my focus would be on upholding the mission, vision, values, statement of the board, supporting the chair, CEO, members and staff. Upholding the duties of the vice chair also outlined in the North Carolina Board of Nursing Policy Number B02. In the year 2022, I got to experience being vice chair and chair within the same year. Being vice chair really had me prepped and ready to step into the chair role. And somebody asked me, why was I running again as vice chair? I'm running because I'm passionate about my work on the Board of Nursing, the regulations and concerns and processes. It will provide me with the opportunity to exhibit my mission as a leader and show my strengths and driving force. I enjoy what I do on the board. If not, I wouldn't have ran for a second term. This is my second time around. And anyone that knows me know that I'm here to support. I'm transparent, love doing activities, and committed to the process. If you sit beside me or anybody that's been around me know that I give you lifesaver mints. And if you're sitting close enough, I'm tapping you, telling you, no, don't open the notebook right now. Okay, if elected, I will have the opportunity to expand on my experience from being, like I said before, the past vice chair and chair. And I will be honored to serve as your vice chair of the North Carolina Board of Nursing for the year of 2025. So I'm asking for your vote. My name is Arlene Imes. Thank you.
And now we will hear for the nominee for vice chair, Tom Minowitz.
Wow, we saved the best for last. That's pretty cool. So I'm Tom Minowitz. I've been on the board for almost 5 years now. I was appointed. It really has been one of the greatest honors that I've had is to be able to serve the state of North Carolina and help the board in any way possible. One thing I'd like to say though is, as you're looking at this slate of candidates, anybody will be a great vote. I think I would be a great vote as well. But regardless of whether it's for chair or vice chair, anybody is deserving. Any one of us is deserving, and any one of us would do a great job at it. I think in the role of leadership, the key is to be a servant leader. And especially as a vice chair, one of the main things you have to do is be there to help support the chair. And I'm more than willing to do that. I feel like my success in my life has come through relationships, building relationships with people. Regardless of how much interaction you have with them, you have to try to get to know the person a little bit as well so you can understand where they're coming from, why their decisions are the way they are. And I think I do a pretty good job of that. And I'm willing to continue to do that. Hopefully I've built good relationships with everybody on the board. And if not, track me down afterwards and we'll work on that. I think I do a good job as the vice chair at supporting whichever one of the chair happens to win. And I just ask for your vote in a few minutes whenever we get to that point. I can't believe the marching band wasn't ready to come in. I thought we had that set up. So thank y'all.
Madam Chair, that concludes presentation of the slate of candidates for 2025 chair and vice chair.
Thank you, Ms. Ellis, and thank you to the candidates for being willing to serve and throwing your name in the hat. And now we will cue the marching band. At this time, we will continue with the meeting as printed. If you're following, it's M10 of your packet. And now we're at the point where we will hear from our Chief Executive Officer, Dr. Crystal Tillman.
Great. Thank you, Madam Chair. And I would just like to thank the board members for their passion and dedication. It's so rare to have a board that is such a great working board. I tell you, I have so many colleagues, And they talk about it's hard just to get members to come to their board meetings. And so we feel really blessed in North Carolina because, one, we get to elect our board members, the majority that are licensed, and our public members are great and certainly serve the public opinion. So thank you for your service. So let's get started with the update. I would just like to say that we had our elections, and the winners, Dr. LaDonna Thomas, and then we have Miss Angela Moore that won the election. Another thing that Madam Chair has done, she has now become an author of a children's book. And so it's been wonderful seeing the progress that she's made. But Charlotte's trip to the North Carolina Board of Nursing, and Charlotte was her mother's name, so it's certainly a nod to her mother. But I think this is wonderful to spotlight the board and spotlight her as a board member, and to encourage young people, that are in elementary school, that, hey, this is something you could do. You could become a nurse. You could become a nurse practitioner and a board member. It's endless. So kudos to her. When it comes out on Amazon, I know that she's getting, I believe, a copy today to proof it. But when it comes out, I'm going to buy a copy for each one of you and have Dr. Thomas sign each one of you a copy. And we'll be sure and put some copies out here as well. And I know staff will, but Amazon, you can buy everything on Amazon. So that's great. So Dr. Terry Ward, congratulations. She was just inducted. She was just inducted to the Academy of Nursing Education Fellows at NLN. I know you attended. Dr. Ingram attended NLN as well. So congratulations. And I see you're wearing your glasses that you wore in the photo, so everyone would recognize you. But she has made such a significant contribution and impact, certainly on mental health nursing education. So we certainly thank you for that. And what an honor for you and for our board. Thank you. Annual audit, just had it this past week. Sat down with Bernard and Robinson, and let me tell you, another year of a clean audit, no recommendations, and we have the excellent internal controls. And we have 2 people to thank for that. Absolutely. So Miss Bellamy, I think you're back there. There she is. Yes, back there with Wes. Yes. And then is Hema in here as well? There she is, right there on the back row. Okay. So thank you, ladies, because that was so much work. And to get a clean audit is absolutely amazing. So thank you both. So Madam Chair and I, at Delegate Assembly in August, we served as the 2 delegates. And we voted, and it's always a pleasure to hear everyone solicit for votes and all. And so we worked well together and enjoyed the delegate assembly. Now, I have to point out here, and I'm so happy you were able to slide in. Tony has been at the NCSBN Board of Directors this week, so he was able to get here. But we had such a nice surprise in that our Tony Graham, Chief Operating Officer, he actually emceed the awards. And what a fantastic job he did. NCSBN took a couple shots of our staff watching Tony do his presentation. But I will tell you that I believe it was total of 5 clothes changes or jacket changes. And it just made it very interesting, and none of us knew, so great job, Tony, and we hope that you get it from here on out. So excellent job. And I love that shot of you, Meredith, because I think that's where they made the statement, Meredith does not like white pants. And so when Tony came out in his white tuxedo, he had to apologize to Meredith. So. And Dr. Steele is always our photographer who lines us up and gets everything together. So this is the group of board members and board staff that attended Delegate Assembly last month. We had Rear Admiral Jennifer Moon, and she is the Chief Nurse Officer of U.S. Public Health Service and the Commission Corps. She was the opening keynote, and her topic was Global Leaders, Americans Health Responders. She was excellent. It was such a pleasure to hear her. And as I'm sitting up front, hearing her and all her work with public health and the VA, I said, Dr. Thomas, you have to get a photo with her because, you know, the work you do and over the NPs of the VA. So anyways, we watched to see what door she was going out because I was like, she's got to have this photo. And lo and behold, if Dr. Steele wasn't ahead of us, she was out to get the photo too. So it just, it was great because we knew she was a busy lady. She was going to be in, take a few pictures and out the door. So this is a quick photo that we got with her, and it was a pleasure to actually meet her. And she spent time talking to us as well. So Tony Graham was reelected to the board of directors for 2 years. So congratulations, Tony. We appreciate you. We appreciate you serving us well. And so this was us at Delegate Assembly, and he did a wonderful presentation and certainly got elected. And then I got reappointed to be the chair of the NCLEX exam committee for another 2 years as well. So I'm looking forward to that as well of serving. Good news in the Nurse Licensure Compact. We are now up to 42 states. Connecticut just joined, so we're so delighted. And as you know, Nursing Compact has the best compact in the US. The physicians, pharmacists, everyone looks to us to see how we do things. So having 42 states is absolutely amazing. I wanted to talk about this a little bit because sometimes what happens in legislature sometimes trickles to other states, and this has occurred in Florida. And so Joe Baker, the executive officer in Florida, brought this to our attention last month. Legislators thought that it would be nice to break down barriers to have nurses be able to enter Florida easier. Not understanding that we already have a compact and that we're able to work in different states if you're part of the compact. So this is in law. It is effective January 1st, 2025. The biggest thing I want you to take away is that you have to have actively practiced a profession for which the applicant is applying for at least 3 years during the 4-year period immediately preceding the date of submission of the application. So if you have taken off or you cannot show that you have worked the last 3 out of the 4 years recently, you get to retake the NCLEX examination again for the state of Florida. So yes, it's the same NCLEX exam nationwide, but we've never had to do this before unless you've had your license lapse. We've never had a state. So in talking to Joe Baker, I said, well, Joe, y'all must not have a nursing shortage down there in Florida because this is creating a barrier, not helping people. So I would just say if you're ever planning to move to Florida, you might want to get your application in before January 1st, 2025. And then any kind of disciplinary action in the last 5 years, certainly you have to do your criminal background check, or if you've been convicted of a felony, misdemeanor in the healthcare profession, or you have any kind of complaint, allegation, or investigation pending, all of that's going to come into consideration before Florida Board of Nursing will license you. So just wanted to make you all aware of that. And it is called the Mobile Act. I would like to thank Dr. Sarah Griffin. She did a wonderful job. The board members and staff have informed me at the NCNA annual conference just last week. Seems like it's been weeks ago, but yeah. But she did a wonderful job and presented to the entire conference. We just not a breakout session. So we certainly appreciate her giving a wonderful board update. And then here was the booth that we had. And I know that Catherine Soderberg, thank you for manning the booth. And this is board members and board staff who were at the conference at the booth that we had. So I want to talk a little bit, keep you updated about the LPNs in high schools. So as we're moving forward, Gaston College is going to be the first nursing program to implement LPN program in high school. So they will be working with their local hospital. That means when you graduate from high school, you will graduate and get a high school diploma, and you will get your degree as a practical nurse. And when you come out of high school, 18, might be 17, you will go right into being able to practice after you take your NCLEX exams. So we congratulate Gaston College, and I know that there's been more programs interested, and I think we're going to see this unfold across the state. And I've talked to a lot of CEOs and employers. This is a perfect segue to get them to become nurses, get them in healthcare, keep them, have employers, hopefully get them interested in going back for their BSN and hopefully their master's. So congratulations to Gaston College. Going to talk a little bit about direct master's entry because we have two wonderful programs, UNCG and Duke University, who are going to come before you this afternoon. Dr. Terry Ward is representing both programs, but to have something new in our state, which is direct master's entry program. So is someone with a bachelor degree that doesn't have in nursing, any nursing education, but is able to do an accelerated master's and get their nursing. So that's very exciting. That's more opportunities for leadership in the state. So certainly look forward to their presentations, but did want you to know that this was new and coming on later today. Okay, quickly, we're just going to go over a few things. We're answering the question, how is the Board of Nursing keeping the public safe? So we're looking at the data from May 24th to August 2024. Sarah's going to give you the scorecard, which is the annual view. Mine is just the snapshot of the last 4 months of showing how we're protecting the public. Now, this slide has so much on it, and as an educator, I was taught never put this much. But the reason I did this is I wanted you all to see how many laws and rules and proposed rules that we're going through. And I would just like to give a shout out to Angela Ellis, who is our rules queen, because that is honestly a career in itself, learning how to get the rules through and the rewrite, and certainly to our General Counsel, Meredith Paris, because they have worked diligently and hard. And thank you, ladies, for getting all these passed. So protecting the public. How are we protecting the public? With education? Look at this. Our NCLEX pass rates for both RN and LPN are above national average. Our nursing education programs are wonderful in North Carolina, so we're so proud of that. I know this is a little bit hard to see, but it is just showing from the top chart is the RNs, the bottom is the LPN, just the amount of nurses that we have coming in by either exam, endorsement, reinstatement, and renewal. And you all have this in your packet that you can look at it much closer. So our numbers keep rising. So thank you to the licensure department. And then this is our APRNs, Advanced Practice Registered Nurse. Look at our numbers. Look at the NPs in blue. As you can see in May, June, July, and August, just great numbers. Graduating and being tested. And then following that, CRNAs, certified nurse midwives, and clinical nurse specialists. We always want to thank our retired nurses for keeping the public safe while they were practicing their profession. So as you can see, we've had quite a few that are retiring. And for practice, just wanted to highlight what kind of calls are they taking? What are the majority of their calls? Because they take a lot. The most frequently inquiries that they receive, the RN scope of practice for performing cosmetic procedures and intravenous therapies and IV hydration clinics. You know, it seems like we get I don't care where you go, you're seeing more med spas, more IV hydration clinics. So they get a lot of calls about that. So thank you for keeping the public straight and for the agencies. And then the general scope of practice for RNs and LPNs for things like accepting assignment, the patient nurse ratios, short staffing, and delegations of tasks to unlicensed assistive personnel in practice settings. And then protecting the public through investigations. I am so proud of this. I mean, we just have a stellar investigations group. And look at our cycle times. It's amazing, you know, from a few days all the way to doing a criminal charge conviction, you know, can go up to less than a year, which is wonderful. But the investigation and legal department work very hard and multiple cases always going on. So protecting the public with our investigations. So this is our snapshot since our last board meeting. Investigations, currently we have 322 active investigations, 243 in compliance, 154 in legal, DWI 122, and criminal case tracking 101. And that's a total of 942 cases. So they do an amazing job. And also in monitoring, Allison Bailey does a great job in our monitoring program, directing it. As a matter of fact, we have the AP and the DP programs, and right now we currently have AP in the non-disciplinary program, 68, and in the disciplinary program, we have 76. So we're working with nurses to try and get them back into practice and to help them get back on track again. And legal cases that you've all just finished up. You finished up license review panel. You had 15 cases, settlement 6, and the joint subcommittee 7 cases. So that's a lot of work that you all have been doing since our last board meeting and keeping the public safe. And then I would like to end with this slide. We have volunteer time that we do as board staff to give back to the community. And our director of practice, Joyce Winstead, sent me this photo. And it was just wonderful. And she said, I just want to let you know how I use some of my volunteer hours. And I guess I was not as familiar with this. So there's going to be an article coming out in the bulletin to make more people aware. But Joyce serves on the National Nurse Honor Guard, and it's memorial service for deceased nurses. And that's such a nice thing to do for nurses who have given so much of their career. So thank you, Joyce, for that. And I can't wait to read the article and read more about the National Nurse Honor Guard. And at this time, any questions that you have? Then I'll turn it back over to Madam Chair. I believe we're going to a break.
At this time, we will take a quick 5-10-minute break. Okay, we will now reconvene the board business meeting. To the members, your vote link was sent to you electronically. So please vote, cast your vote during break, and we will announce the results of the election before the end of this meeting. As we move the agenda along, I would like to recognize the Sheps Center, APRN Dr. Catherine Moore and Dr. Connor Sullivan.
Thank you, Madam Chair, and Dr. Tillman and members of the board for the opportunity to be with you this morning. I'm Catherine Moore. I'm the Director of the Health Professions Data System at the Sheps Center, and I'm here with my colleague, Dr. Connor Sullivan, who is a research associate and a data analyst with the Sheps Center. And we are just very thankful to be here on behalf of the entire research team at Sheps that worked on this project to be able to do some highlights of the findings of this APRN report or of APRN study. And I'm going to begin with our funding statement and thank the Board of Nursing for supporting this work. The collaboration and the support, we are very thankful for it at Sheps, and also by stating that the information, content, and conclusions that we present here today are those of the authors of this report and this study, and they should not be construed as the official position or policy of the North Carolina Board of Nursing. And again, Dr. Sullivan and I are honored to be here to present the findings of this study, but as you can see from this slide, there was a good research team at Sheps that came together to do this work. We were led by Dr. Aaron Frere, who was our principal investigator. We had an APRN expert and clinician and workforce researcher, Dr. Lorinda Combs, who was on our team, Andy Napton, who is a modeler based in the UK, data analyst Tony Kane, project coordinator Haley Simmons, and another data analyst and visualization specialist Evan Galloway. So we thought it would be helpful for the newer board members and members of the public to begin with a little bit of a background information on the Sheps Center and also to talk about our collaboration with the Board of Nursing over the years. So the Cecil G. Sheps Center for Health Services Research has been in place for about 50 years, and we're one of the oldest and largest health professions research centers in the country. We collect and disseminate information on 21 different health professions. And as an illustration to kind of explain the structure of the Sheps Center, you can think of the structure of Ukrainian dolls. And so that overarching Sheps Center is further divided into about 12 different research programs. We have a program on aging, a program on rural health, and we are located within the program on health workforce research and policy, which is co-directed by Dr. Frere and Dr. Brianna Lombardi. So within that overarching umbrella, we have Sheps Health Workforce NC, and that's where we do a lot of our state-based research and work across the health professions. This is the team that I direct. My colleague, Dr. Sullivan, is part of this team. We also have a colleague, Abhi Joshi, who is here. Evan Galloway and other members of our team weren't able to be here today. We also have 2 federally funded centers. The Carolina Health Workforce Research Center is directed by Dr. Aaron Frere, and then we have the Behavioral Health Workforce Research Center directed by Dr. Brianna Lombardi, and those are 2 of 9 federal workforce centers in the country. A little bit more information on Sheps Health Workforce NC. Our mission is to provide timely, objective data and analysis to inform health policy in North Carolina and across the country. We are based at Sheps, which is located at UNC Chapel Hill, but our mission is statewide. We are independent of government and healthcare professions, primarily grant funded, and we do not represent a particular profession, specialty, or educational institution. So Sheps has a strong relationship with the Board of Nursing over the years, and our synergistic missions and complementary areas of expertise have facilitated opportunities for collaboration during this time. Some of the projects in the past include the annual data collection and dissemination of nursing workforce data. As I mentioned before, we collect and disseminate data on 21 different health professions, and the analysis of that data, including the analysis of nursing data, is funded by North Carolina AHEC. We've also worked collaboratively with the Board of Nursing on ad hoc reports over the years as new issues arise where we are able to work together. Most of the board members, I imagine all of you are aware of the NC WorkCast study that was done. That was a major collaborative effort with the Board of Nursing and funded by the Board of Nursing. And now we're pleased to talk about our APRN study, which is another major collaboration with the Board of Nursing and funded by the Board of Nursing. I'm not going into the details in this slide, but I really wanted to give an update on just the impact of NC NurseCast since it was released in November of 2021. So I took these numbers on September 18th, but since that model was released, we've had 15,100 visits to the website from 95 different countries. We've had 13,600 unique visitors to the web pages contained in the NurseCast model, and it is shaping state and national policy discussions to address the nursing workforce shortage. So, I mean, this is major work that was done in North Carolina. And now I'm happy to start sharing some highlights from the APRN workforce study that was conducted in the hopes that this will pique your interest in reading the full report, which we're not going to go into the minute details of today. I spoke with Dr. Tillman earlier, and she said it was okay to announce that SHEPS will be posting the public report on our SHEPS website. We're hopeful on October 1st, and so that will be available for the public to view as well. So the APRN study did draw on licensure data from the North Carolina Board of Nursing, and the sample for this research study includes all 4 advanced practice roles who were in active practice in North Carolina between 2013 and 2022. And so active practice includes nurse practitioners, certified nurse midwives who had an approval to practice, and an active North Carolina practice address during that period of time. And then for the CRNAs and clinical nurse specialists, they had a recognition by the Board of Nursing, and again, a North Carolina practice address. So that's our sample. Data analysis included descriptive and bivariate analyses conducted using chi-square and t-tests to assess whether differences in groups and over time were statistically significant. And then one other major part of this study was the convening of an expert advisory board. And this was a big collaborative work with the Board of Nursing in identifying experts across all 4 APRN roles who could come together and inform the study. They reviewed the validity of the project's findings, and also this was done to promote transparency of the research along the way. The experts helped to interpret study findings in the context of their roles as leaders, as clinicians, as regulators, and related to their expertise in policy as well. And the final expert advisory board included 14 members. In addition to those 14 members, the APRN consultant from the Board of Nursing and then our APRN expert member of the research team, we had a combined 270 years of APRN practice to draw upon during these discussions of the data findings. So a lot of rich discussion as we went through this project. So some additional context before we get into the findings. It's important to explain the importance of this work. So we know that North Carolina's growing and aging population is increasing the demand for services at a time when the state is confronting health workforce shortages. We hear reports of patients who are not able to get an appointment with a primary care clinician, and the demand for behavioral health services has increased dramatically since the pandemic. Advanced practice registered nurses are one important component of those interprofessional teams that are needed to meet physical and behavioral health needs of patients and populations in the state, and to address those social risk factors that can affect health. We know that legislative discussions in North Carolina related to reimbursement, regulation, scope of practice have been ongoing in our state at least since the early 1990s. And understanding the supply, distribution, and practice characteristics of the advanced practice workforce is pivotal and critical for providing state and federal policymakers with data on the current numbers of the workforce, the populations they serve, the settings in which they practice, to further inform those policy discussions with accurate data. Now, this work is also important for adding to the body of literature related to APRN workforce. National data sources on the numbers of APRNs in practice do not agree. For example, in 2022, data from the Bureau of Labor Statistics grouped nurse practitioners, CRNAs, and certified nurse midwives together, and then had an estimated 323,000 APRNs in the U.S. in that year. And then compared to the American Association of Nurse Practitioners, and reports from their database noted that there were 385 nurse practitioners in the United States during that same year. So you can see how those numbers are not matching up. Now, most APRN studies are at the national level, and there are some state-level studies on the workforce, but they rely on survey data. And so they suffer from potentially low response rates, produce results that might not represent the true population in the state. And so this study, in collaboration with the Board of Nursing, uses licensure data from the board. So we were able to access the full census of APRNs in active practice in North Carolina. And this is important for more accurately enumerating the supply, distribution, and characteristics of the APRN workforce in North Carolina to inform employers, educators, associations, and policymakers in the discussions that they have related to this workforce. So now I will finally start beginning the conversation of the findings from this report. Similar to national trends, nurse practitioners in North Carolina comprise the largest percentage of the APRN workforce. In 2018, they were 72% of the workforce, and then in 2022, they represented 76% of the active North Carolina APRN workforce. Some demographics of nurse practitioners in 2022, we had a total of 11,612 in active practice. 91% were female. The average age was 44 years. Regarding race and ethnicity, 77% were identified as white, 14.3% as Black or African American, and 2.6% identified as being of Hispanic race. And this is different, although the nurse practitioner population is growing and changing in its diversity, it still does not represent the North Carolina population. In 2022, about 20.9% of the population identified as Black or African American, and we had 11% of the population that identified as Hispanic. So there is still work to done, even though we are growing in that diversity. Nurse practitioners in North Carolina had approximately 8.5 years in active practice since graduation in 2022. And when you compare this from national data that suggests that about 47% of nurse practitioners have less than 6 years of active practice, that's very different in North Carolina. When we looked at the different certifications, acute care nurse practitioners and psychiatric mental health nurse practitioners were the only two categories where the majority of the APRNs in active practice had less than 5 years. So we have an experienced workforce of nurse practitioners in North Carolina. North Carolina has experienced rapid growth in nurse practitioners compared to physician's assistants and the physician workforce. This chart shows that from 2000 to 2022, we've had a 429% increase in the nurse practitioner population, compared with a 228% increase in the physician assistant population, and then a 28% increase in the physician population. However, we still have twice as many physicians in North Carolina as nurse practitioners. Now, to zoom in a little bit more and comparing the nurse practitioner growth rate with the APRN roles, between 2013 and 2022, nurse practitioners grew at a rate of about 147%. And then zooming in a little bit closer, looking at 2018 to 2022, we had a growth rate of 48%. And I want you to keep that 48% in mind as we go forward and compare that growth rate with the other APRN roles. So in North Carolina, there are multiple pathways that an individual could enter the advanced practice registered nurse workforce. Within the North Carolina pathways, they can enter through an education pathway. And so you have your newer graduates with less than 2 years since they graduated from a program located in North Carolina. Then you have your North Carolina delayed entry individuals. These individuals were educated in a program located in North Carolina, but they delayed their first approval to practice or recognition by about 2 years or more. And then we have individuals who return to the workforce. So these individuals had a previous approval to practice or recognition as an advanced practice nurse. They became inactive for a period of time, and then they returned to practice with a newer approval to practice or recognition. And then our out-of-state pathways include those new APRNs with that have had 2 years or less since since graduating from their program, and those programs are located outside of North Carolina. And then out-of-state previous practice, those individuals, has had their education outside of the state. They practice outside of the state before then coming to North Carolina to get an approval to practice or recognition. Now, for nurse practitioners, a higher percentage of new North Carolina nurse practitioners enter the workforce through out-of-state pathways. In 2022, we had 11,612 advanced practice nurses in active practice in the state. And of those, we had 1,940 that were included in those new entrants and returners to the practice in that year. And as you can see with the box all the way to the right, 60% of those came from out-of-state pathways as compared to the almost 40% that came through the North Carolina pathways. And in the full report, we have more detailed tables that further illustrate that over time, a decreasing percent of North Carolina's active nurse practitioner workforce is educated in programs located in North Carolina, and then an even lower percentage of newly educated nurse practitioners are coming from programs located in North Carolina. Now, this is one of those findings where it created an interesting discussion among the expert advisory board. They felt that, the data that we presented to them that we had available for analysis, it couldn't tell whether those individuals were enrolled in hybrid programs, whether they were enrolled in online programs, and we had no way of telling where the clinical component of those programs took place. And so to truly say where a nurse practitioner is educated, that additional information they felt would be able to further inform the study, but we did not have that available to us. So that was an important point that was discussed among the members. Now, although the majority of nurse practitioners in North Carolina are family nurse practitioners, the nurse practitioner certifications with the fastest growth during the 2014 to 2022 period included the psychiatric mental health nurse practitioners. And I'll try to use my little pointer and not blind anybody, but you can see that they grew at a rate of 300% during that time frame, followed by acute care nurse practitioners who grew at a rate of 225%. And then I'm going to cover up that's the next slide. Additionally, something to point out on this slide is that we had 690 nurse practitioners in 2022 who were dual focused. So they had more than one certification. And this was very interesting. So of those, we had about 364 that were family nurse practitioners. And of those 364 family nurse practitioners with a dual or multi certification, you can see that half of them had that second certification as a psychiatric mental health nurse practitioner. So those were some very interesting findings as we went through the study. So in 2022, 9,816 of the 11,612 nurse practitioners in active practice answered information on their application related to race and ethnicity. And among those who reported race and ethnicity, 18% identified as being representing an underrepresented minority. And that includes health professionals who self-identify as Black or African American, American Indian, or Alaska Native, or of Hispanic race. And within those 18%, you can see from this slide that a higher percentage of nurse practitioners as family nurse practitioners, dual or multi-focused, or in psychiatric mental health represented that underrepresented minority status. And this was of statistically significant relevance. Now, the fastest growth of nurse practitioners as far as settings was experienced in home health, mental health, other settings, and long-term care settings during this period of time. And then also we wanted to point out that in 2022, we had about 1/3 of nurse practitioners that identified as being in a group medical setting. And this was an interesting point of discussion during the expert advisory board meetings too, because they said that group medical is a general term, and without a definition, it was open to broad and varied interpretation. And additionally, one member of the EAB said that healthcare organizations may use that term within their institution to define structural organization within the healthcare system. So that could further cause a little confusion for licensees when they're answering the question related to group medical. So it may warrant a little bit of additional understanding when filling out those forms. In 2022, we had a higher percentage of newly educated nurse practitioners working in group medical and mental health settings. We had 41.3% of the newly educated nurse practitioners working in the group medical setting as compared to 36.4 of the total active North Carolina workforce. In the mental health setting, you'll see that we had 7.3% working of the newly educated nurse practitioners working in the mental health setting versus 5.1% of the total active nurse practitioner workforce. And this was noted to be of statistical significance as well. That was supposed to help you zoom in a little bit further, sorry. So when zooming in to look at the nurse practitioner supply in the hospital inpatient settings, in 2022, we found that nurse practitioners comprise the largest percentage of nurse practitioners working in hospital inpatient settings. However, only 7.6 of all family nurse practitioners actually work in that setting. So they did comprise a decent amount within the hospital setting, but that is not the primary place that that entire population practices. A decreasing percentage of the North Carolina nurse practitioner workforce is practicing in metropolitan counties. You can see in 2013, we had 15.9% working in non-metropolitan counties compared to 22% of the population. And in 2022, we had 14% of nurse practitioners in non-metropolitan counties compared to almost 18% of the population. And as you can see or not see from this map in 2022, that, the actual rate per population, per 10,000 population of nurse practitioners across the state varies. There's a little section up here where there's a gray area, that's Gates County. They had no nurse practitioners in 2022, as compared to these darker shaded areas of Orange and Durham County, which had 28 and 29 nurse practitioners per 10,000 population. Respectively. So again, members of the Nurse Practitioner Expert Advisory Board discussed that this is important to remember, that in order to work in non-metropolitan counties, you have to have employers there that exist and that are hiring nurse practitioners. So we've heard stories of the closures of rural hospitals across the state over the years. So those employing agencies are not there to actually have the nurse practitioners in practice. And so that is something important to consider. And it does affect the distribution of nurse practitioners in the state. Nurse practitioners do make up an increasing percentage of the non-metropolitan clinician workforce, even with the decrease in percentage of the number that work in non-metropolitan counties. And this is because physicians and physicians' assistants are also in the decline as far as they're working in those counties. However, physicians do continue to comprise the largest percentage of the non-metropolitan workforce in North Carolina. And the SHEPS team really feels that this is one of the most compelling data points in all of our findings, and that is within non-metropolitan counties, 73% of nurse practitioners are family nurse practitioners, which is so critical to being able to deliver primary care in these non-metropolitan communities. Additionally, a higher percentage of nurse practitioners in non-metropolitan counties practice in the group medical and public and community health settings. And again, this is important to that crucial delivery of primary care services in those areas, as compared to metropolitan counties, where you have 17.8% and 9.8% respectively working in inpatient and hospital outpatient centers. So now I'll be moving on to the second most populous APRN workforce in the state, and that is our certified registered nurse anesthetists. In 2022, we had a total of 3,061 CRNAs in active practice. 67% of those were female. They had an average age of 46 years, and 89% of the workforce at the time identified as white. And they had approximately 14 years in practice since graduation. Now, SHEPS started receiving data on the CRNA and the clinical nurse specialist workforces in 2018. And so that's why you'll see for these APRN roles, we have a shorter time frame for looking at the trend lines in their growth. As you can see from this slide, we had 2,710 in 2018 and then 3,061 in 2022. And this is a growth of about 13% of the CRNA workforce over this time. As compared to the nurse practitioner workforce, you can see that they did not increase at the same rate. Something else that is different within the CRNA workforce is that most CRNAs enter the workforce through North Carolina pathways. Approximately 60% of CRNAs are educated in programs located in North Carolina. And again, this also differs between certified nurse midwives and certified nurse practitioners, and where they have the majority of their individuals educated out of state. And this was something that was discussed at length with CRNA members of the Expert Advisory Board, that while we have a higher percentage of individuals from the CRNA workforce entering through North Carolina pathways, they felt that it was worth looking into the percentage that we lose from after they graduate from their North Carolina program and then exit to go to another state to practice. And we know that the Board of Nursing does not regulate or collect data on the graduate programs in North Carolina. However, we were able to obtain data from the 6 anesthesia programs in the state in response to the Expert Advisory Board concerns. And during the period of 2019 to 2022, we had 485 CRNAs that graduated. And in that period, the retention rate of graduates was about 60% or 65% in the state. And then per cohort, the annual number of graduates differed between schools ranging from 12 to 34 per program. And the annual in-state retention rates did vary widely between programs. Some had a rate of about 30% retention rate all the way up to 92%. We have in North Carolina a decreasing percentage of CRNAs working in hospital settings. That decline is from 69.1% in 2018 to 64.9% in 2022. And in 2022, North Carolina had 2.87 CRNAs per 10,000 population. However, that rate varied by county, and we had about 20 counties that did not have CRNAs practicing in the state. And again, those are represented by these gray shaded areas. And the percentage of of CRNAs in practice who have practiced in non-metropolitan counties declined from 2018 of a percentage of 9.6% to 8.5% in 2022. Now, within those non-metropolitan counties, a higher percentage of CRNAs were found to be working in hospitals, and fewer were found to be working in ambulatory care settings, and these were noted to be statistically significant. And this was another important discussion point among the members of the Expert Advisory Board. You know, they talked about how there's a generational shift in CRNAs who work full-time versus part-time, and those who are working under contracts. And then we were given an example that can kind of further illustrate how it is difficult to actually track where CRNAs are working in the state, especially using licensure data. So a CRNA may own their own business, and they may be the only employee of that business. So you have that one employee, and then they subcontract to a larger anesthesia organization that may have contracts all over the state. In hospitals and ambulatory care settings, and depending on the state's needs at the time for CRNA services, that one CRNA may go to non-metropolitan areas. They may go to metropolitan areas in different settings to practice. And so this is not information that we can find from licensure data, because we go by the practice address in the licensure file, which may differ from the multiple sites that CRNA is working. So that was one really important key point that the Expert Advisory Board helped us with. And now I will turn things over to Dr. Sullivan.
Thank you, everyone. I'll be talking about the certified nurse midwives. And so in 2022, we had a total of 385 certified nurse midwives. There was an average age of 46 years old and 99% identified as female. 12.4% identified as underrepresented minorities, and approximately 11.7 years of practice since their education. And that's actually a decline from 12.6% in 2013. And so the C&M workforce has gotten slightly younger. It was actually 47.5 in 2013 years old, and then 12.6 years of practice in 2013. In terms of the growth, we've seen a growth of 262 certified nurse midwives to 385 in 2022, which is a 47% increase. And as you'll remember from the 5-year growth rates that Catherine was mentioning, the nurse practitioners grew 48%, the CRNAs grew 13%, and then the CNMs grew 27%. So right there in the middle in terms of their 5-year growth rate from 2018 to 2022. Now, in terms of, we've talked about their growth, we've talked about a little bit of their demographics. Let's talk about where they are educated, or the programs in which they're educated, where are located. And as Catherine mentioned, the majority of certified nurse midwives are educated in programs that are located out of state. We have East Carolina University as the sole educational institution for certified nurse midwives in the state. And then a majority of certified nurse midwives are educated from out-of-state programs. Though, like we've mentioned, they might be doing their clinical rotations or their clinical placements in North Carolina while taking an online course. For example, a significant minority of the data of out-of-state programs is actually people attending the Frontier Nursing Program in Kentucky. And so moving on to the diversity of the certified nurse midwife workforce, as you heard me say, 12.4% identified as underrepresented minorities in 2022. This has been a significant increase since 2013 of 8.4% to 12.4% over that time frame. Though if we keep in mind the North Carolina birthing age population who identify as underrepresented minorities, that has actually hovered at 34% over the same time frame. And so it is still much less than the underrepresented minority birthing age population in North Carolina. So that's something to keep in mind, that as we strive to match population to the people caring for them. In terms of where certified nurse midwives are working, or what self-reported settings they are reporting, you'll notice that even in a 5-year time frame, so just going from 2018 to 2022, there's been a significant decrease in the CNMs reporting that they are working in a group medical setting, going from 50.8% in 2018 to 40.5% in 2022. And you'll see that was actually a statistically significant decline, and that the increase has gone to all of the other settings, for example, hospital inpatient, hospital outpatient, the increase in the other and all other settings. This, even as we drill down further, exists for the newly educated certified nurse midwives who are practicing most in hospital settings. So if we take a look at the hospital inpatient and hospital outpatient and group them together, you'll see that it's 46.2% of those newly educated certified nurse midwives, compared to 37.7% of the total certified nurse midwives. Now, this difference is not statistically significant, though if this trend were to continue with bigger numbers, I would imagine that that would be the case. Though it's something to keep in mind with the previous slide, where there's been that decline in group medical and an increase in hospital settings. Though, as we were mentioning previously, this is also wholly dependent on the organizations in who are hiring certified nurse midwives. So if there are no hospitals or group medical settings that are hiring, then that's not going to be the case. And same thing for if we take a look at the actual map of where certified nurse midwives are working. There are 43 counties that had no certified nurse midwives, so all the areas that had gray areas. However, again, this might be that someone is reporting a parent organization and that they are working in multiple sites. And so we are going based on what is the primary location that is listed in their licensure record. The percentage of the certified nurse midwife workforce in non-metropolitan counties is declining. So you'll see, very similar to what we said for the other APRN roles thus far, 16.8% in 2013, down to 13.5% in 2022 compared to the North Carolina population, which has seen also a decline in the percent in non-metropolitan areas, but not as much of a decline. And then if we focus in on those who identify as underrepresented minorities by their metropolitan status, I want us to focus on the non-metropolitan section of this, where it is a smaller part of the certified nurse midwife workforce, though proportionally there are more underrepresented minorities who are working in these non-metropolitan areas compared to the non-underrepresented minority identifying people who are working in non-metropolitan areas. And that is also statistically significant. And as we move into talking about clinical nurse specialists, there's a total of 250 clinical nurse specialists in 2022. They have an average age of 54 years, which is higher than the other APRN roles. 96% identify as female and 8.3% identified as underrepresented minorities. They have approximately 17 years in practice, and this is also, as you might have noted, higher than the other APRN roles. In the 2018 to 2022 timeframe, because this is also much like the CRNAs, we started receiving data on clinical nurse specialists in 2018. We see an increase from 191 CNSs to 250 by 2022. And that makes them actually the second highest growing APRN role in that timeframe. 48% for nurse practitioners, 13% for CRNAs, 27% for CNMs, and then CNSs at 31% in the 5-year 2018 to 2022 timeframe. In terms of how CNSs enter the workforce, much like CRNAs, they are actually majority entering through North Carolina located programs. And they practice mainly in hospital settings. So there's actually a majority who are practicing in hospital settings, and that has stayed stable over time. So you'll see it's 48.2% in 2018 and 53.6% in 2022, though that difference has not been statistically significant. The only statistically significant difference there has been a shift in other, where people are perhaps being more specific about where they're working. And then in terms of where clinical nurse specialists are working, most North Carolina counties do not have CNSs. Though again, this may be the same piece where if someone is reporting a parent organization or something like that, and they're working across multiple sites, then we cannot see that in that data. And there's actually a state rate of 0.23 CNSs per 10,000 population over the course. And so with that, with all of the data, I know that we've talked about a lot of data with you today across the 4 APRN roles. We just want to take our time to thank you all for letting us come and speak about the data, and hope that you took some good data points away with you today. Maybe have some strong takeaways that you might want to share with us as you reflect on it. And if you want to, please find us and follow us at the Cecil G. Shep Center. You can find us at nchealthworkforce.unc.edu or go.unc.edu/workforce. And if you'd like to sign up for the newsletter, it's actually quite nice. You could sign up for it using this information. If you'd like to contact Catherine or myself, here's our contact information. And we'd like to leave it up to questions to the board. Thank you so much.
First of all, thank you for presenting this information. It's very interesting. And looking as the APRN representative in the board, I'm looking at the fact that the second highest growth rate are the certified nurse midwives, but yet we have 43 counties that don't have certified nurse midwives practicing there. So that's a little disheartening. But looking at the psych mental health nurse practitioner role, we see obviously, especially I think after COVID, a lot of my colleagues are saying they are going into that role and getting certified for that because of what happens and what we definitely need that role there. But thank you for providing us with this information.
Absolutely. Thank you so
yeah.
much. I just want to actually comment on what you just said. My background is actually as a psychologist and in the behavioral health space. And one of the things that stood out to me as actually during the course of this report was that there was quite a bit of growth in the psychiatric mental health nurse practitioners, and especially actually in the those who are identifying as underrepresented minorities within that group. They showed quite a bit of growth in that area as well.
So that is very good to see. And board members, do you have questions for Doctors Connor and Moore? We have one from Dr. Ingram.
Thank you, Dr. Moore and Dr. Sullivan, for your presentation. Very informative. I did have a question, Dr. Sullivan, about, I think it's slide 42. I just want to make certain that I understood you correctly. And so maybe it's for you, this one. Yes. Can the underrepresented minorities, can you just restate what you said, please?
Sure. So in terms of if we take a look at the metropolitan counties versus the non-metropolitan counties, so the more rural areas, if we then also look at the people who are identifying as underrepresented minorities, they are working more in non-metropolitan areas proportionally. You'll notice that there's 11 that are working in non-metropolitan counties, but proportionally that's making up 27% of the people who are working in those rural areas, compared to 35 of the non-underrepresented minorities, 12% who are working in those same areas.
Thank you. Thank you for that clarification. Another comment. So I definitely don't have the evidence to support this statement or this communication that I've been hearing about an oversaturation of advanced practice nurses, more specifically NPs. Did y'all encounter any of that data in terms of employment? So, going through schooling, getting the education to become an NP and having difficulty finding employment here in North Carolina.
I don't recall, that would have been the discussion that would take place among the expert advisory board members that informed this study, because they were, the individuals that we gathered to tell us what was happening, and do the data reflect what you're seeing in practice. And I don't recall conversations where they were saying that they could not find a position. Now that, the discussion of the non-metropolitan counties and the ability to work in those, that may be part of the issue, because of their statements where they were saying that in order for us to work in those areas, the hospitals need to be there for certified nurse midwives, the birthing centers, or wherever they work. So those might be some examples, like if just the entities don't exist for them to go to.
I would say too, that also gets at the idea of something similar to what NurseCast did, where there's also looking at demand data. And so since this is just supply data and licensure data, we cannot quite get at that.
Yes. Thank you.
Any other questions? Thank you. And I really look forward to
I had a
the
question,
full report.
Madam
Oh, I am
Chair.
so
Sorry.
sorry.
That's okay.
Dr. Shaw.
Just a follow-up question. In the study, will there be recommendations that will come out of this workforce study? I see the data, but will there be recommendations as well disseminated?
We do have more elaboration in some of the contextual issues that within the larger report. And so there are some of those talking points there. And, we are just now starting to disseminate this information and have those conversations related to policy implications, education implications. So I do anticipate that using this report, there will be additional discussion and follow-up recommendations.
Others? Thank you. And I look forward to the full report. I think you said October 1st? It will be out?
Yes, the public report will be
Public
published
report.
on October 1st on the website. Mhm.
Okay. Awesome. Thank you so much. As we move along, if you're following me in your agenda, M12, the strategic plan update, I welcome Dr. Sarah Griffith, Angela Ellis, and Angie Mathis.
Thank you, Madam Chair. Good morning, everybody. The report for the strategic plan is located in your packet in M12. These updates highlight some of the key accomplishments since the May board meeting, so it won't highlight every single item throughout the strategic plan. So Achieve It is the platform that we utilize to manage and implement our strategic plan. We have 3 Achieve It champions, Angie Mathis, Angela Ellis, and myself, and we work closely with Dr. Tillman to execute this plan. As champions, we're responsible for reviewing the updates, preparing reports, discussing targets with each of the departments, and presenting any new targets to Dr. Tillman. The strategic plan team is responsible for being the lead or the point person for the department, and those team members include Jennifer Pelletier, Joyce Winstead, Jennifer Lewis, Kimberly Luisana, Himmer Pamar, Allison Bailey, Daisha Williams, Meredith Paris, Jeff Howlett, and Tony Graham. As you can see, the strategic plan is a full organization team effort, so it's not one single person that's driving this plan. The board has engaged in strategic planning for over 20 years. This current plan is a 4-year cycle plan with new targets identified on an annual basis. When the plan was developed, and we engaged with public, external stakeholders, your board members, we did a survey to establish this current plan. When we will begin discussing the next strategic plan sometime in 2025, so more information to come on our next strategic planning cycle. So I'll now turn over the presentation to Angie Mathis, who will review strategic initiatives 1 and 2, and then Angela Ellis will review 3 and 4. Thank you.
Thank you, Dr. Griffith. Madam Chair and members of the board, as Dr. Griffith said, we're going to just do a highlight of some progress on some of our targets. We're not certainly going to go through every target, but just to remind you, we have the 4 initiatives. Enhance public protection through collaborative leadership was our first one. Advance best practices in nursing regulation. Cultivate an organization that supports diversity, equity, and inclusion. And foster mobility of licensed nurses to facilitate access to safe nursing care. And these are 4 initiatives that you, as the board, approved for our 4-year plan. So our first initiative, just going to highlight a couple of objectives. The objectives you also approved as board members. Ensure fair, efficient, and effective regulatory processes. Highlighting a few of the targets. The first one, review and revise all of our regulatory policies to ensure that they align with law and rules. And we can report that phase 1 has been reviewed, and that included administration, communication, HR, and operations. We're moving into phase 2 now, which is education practice, legal, investigations, and monitoring and compliance. So we're well on track with that target. Perform positively compared to benchmarks for cycle time with our licensure department. And we excel in this area. We hear from time to time when we go to other meetings about how many days or weeks it takes, or months sometimes, for folks to get licensed in other states or even to get a response. And we continue to have a very impressive cycle time. In August, for example, just about 2 days or well under to get licensed once all the information has been supplied by the applicant. The target, review sample cases for accuracy and appropriate violations at the time of the case resolution. This is where we are pulling sample cases, looking at what is actually cited at the conclusion of a case and what we have evidence of a violation as to what the case started at. For example, if the case started as an allegation of neglect, but at the end of that, we did not have evidence of neglect, but perhaps we had evidence of another violation, looking to ensure that we are updating that so we get good data on cases that have been resolved. Review feasibility for a pilot program for licenses with mental health challenges affecting their practice. We have gathered information from a number of other boards, and we're now working on a list of potential providers or evaluators. So when we have licensees that we need to send for some type of fitness for duty evaluation to determine if they are safe to remain in practice, we want to have a list of providers so we have folks throughout the state to increase access for these licensees. For example, if you have a licensee in Nags Head, we would not want them to have to drive to Raleigh if they were having to get a fit for duty eval. It would be nice to have folks throughout the state who can do these evaluations and ensure that we get the information we need to help make the decisions whether they're safe to practice or not. Provide adequate resources to fund programs, services, and ops through a strong financial position. In just a little bit, you will get a complete report from our CFO, Gail Bellamy, and the Finance Committee, and hear from our folks from Wells Fargo's advisors. So I won't get into money. Increase visibility and impact to the organization. Technology to provide stakeholders a better understanding of what we do. Of course, we're streaming this online. The communication team continues to post stuff on social media on a regular basis. We develop QR codes to try to get more folks to follow us on social media. When we do presentations now, we give the QR codes out and we encourage folks to follow us because that's how we quickly push information out. For example, we get calls from time to time about someone has been the subject of a phishing attempt or a scam, and they call and they say, somebody called me and told me I'm going to be arrested and that the board's looking at me and they gave me the badge number. Well, when we look up the individual, it's just a scam. It's a scam attempt. And so when we get those calls, we can push that type of information out on social media to alert our licensed nurses. If you get this kind of phone call, be aware. Do not be giving out your credit card numbers or anything like that, because we wouldn't do that kind of thing. So we can quickly share information with our licensed nurses and with the public. Identify opportunities to communicate with the public and licensed nurses. Last week, Dr. Tillman showed the photo. Several of us attended the NCNA, and a few of us manned the booth, and it was over, I think, 500 nurses attended this event. We had great response, folks stopping at our booth, us giving away our pens and pads and whatnot. And I just have to comment, we got so much positive feedback. People continued to stop by saying, the website, I can find what I need. They say every time I call, every time I email, and this was through different departments. This was not just one. They said, I've called licensure, I've called this, I've called that. They say, you all are so responsive and you always do such a good job of getting information, answering our questions. So I think that's important to bring that good feedback so staff know that folks are seeing that we are responsive when people email or call with various needs and questions. Increase visibility and impact. Here is our numbers. I'm not going to read all of them, but as you can see, every number on social media continues to grow. And I would imagine if we pulled those numbers today, they're probably even higher after we went to NCNA last week, because we gave out QR codes and so many people we would ask, do you follow us on social media? No, I don't think so. Or I don't do a lot of social. Well, here, try, just follow us. We push out good information. We're not going to be doing silly stuff. But I think we can continue to see a positive response and our numbers growing with our social media. And we also continue to provide education for nursing students, for both pre-licensure and Dr. Kimberly Louisana doing APRN student presentations. Our initiative number 2, advanced best practices in nursing regulation. The first objective is about research that expands evidence for regulation. Just heard the wonderful presentation from SHEP Center on the APRN research. Another target, they're conducting medication-assisted treatment research study. The IRB approval was obtained, and now they're reviewing the data to prepare that for a statistician to do the analysis.
Provide education and consultation related to our recent revisions to the telehealth, telenursing position statement that was done earlier this year. Articles have been shared, both published in the bulletin and in the education communique. Also shared again via social media and on our website, and different practice presentations and our workshop that we offer for nursing regulatory leaders have been updated to include this new information about the position statement revisions. Phase 2 of the CNM rules, that is well in progress, and I think we're getting in the short rows of that. And that is working with the Midwifery Joint Committee to adopt rules pursuant to Senate Bill 20. Provide education and consultation about telehealth and telenursing, especially specific to the revisions to the position statement. We've gotten the articles and practice. I think that's just a duplicate. And practice, they continue to take calls and answer questions on telehealth. Identify and address issues with the opioid epidemic. One target was to increase the geographic range and number of treatment facilities and available addictionologists to conduct evaluations on our licensees. And they have added several facilities and addictionologists to the list this year to expand access. Again, so if a licensee lives in the far west, they don't have to drive maybe to Raleigh to have an addictionologist evaluation conducted. We continue to periodically receive data from the division, the Health and Human Services, and on controlled substance reporting. And this is where prescribers of controlled substances, they are required to sign up with the North Carolina Controlled Substance Reporting System, and they're required to query the database before they prescribe certain controlled substances to their patients. And if they're prescribing, but they're not appropriately registered with the Department of Health and Human Services, we are getting reports with a list of those prescribers that aren't properly registered. And so we are pushing out information to those folks that are on that list to try to educate them about the proper requirements. And now I will turn it over to Angela Ellis.
Okay, thank you. As we head into strategic initiative number 3, cultivate an organization that supports diversity, equity, and inclusion. So the objective under here is to promote a diverse organizational environment that fosters creativity, innovation, and outstanding leadership. Staff continue to participate in professional development, leadership preparedness, as well as succession planning. We will be providing a full report in January, but what we wanted to highlight today is that we have 3 staff members who graduated from the National Council State Boards of Nursing, ICRS Leadership Academy this year, and we have other staff who are continuing to take courses towards graduation. As mentioned previously, we've had staff attend the National Council Discipline Case Management Conference and had both board members and staff at the annual delegate assembly. Our second target was to develop and implement the Board of Nursing internship program. Dr. Griffin and I work with Dr. Tillman in developing this program. We are happy to announce our communication intern we had over the summer completed their project. Dr. Griffith and Catherine Soderberg will be attending his presentation tomorrow morning at the high school. And then we have an investigations graduate student intern who is currently working with Jennifer Pelletier in investigations. So we hope to continue to increase awareness of regulation and maybe encourage some future leaders in regulation. Strategic initiative number 4, foster mobility of licensed nurses and facilitate access to safe nursing care. The objective here, support efforts of ongoing nursing workforce trends. So the education annual summary report is currently posted on our website and is available for use by stakeholders. So what's coming up for our next strategic plan? We're currently working with our strategic plan team members on proposed targets for the 2025 roadmap. This will be the last roadmap for the current plan. And we will present a full report in January board meeting, which will give you those proposed targets. So we are starting to look ahead and start planning for development of the 2026-2029 strategic plan. We will begin that work next year, and we'll present to the full board in January of 2026. So we will be working on what that looks like. We'll let board members know and encourage participation in that process. Are there any questions for us related to the strategic plan?
Ingram?
Thank y'all so much. Excellent. I'll just say that and ask just this one question for time's sake. So your internship program, I just think that's awesome. And you mentioned communication and investigation. How do you market that? Because you mentioned a high school student and a graduate student. And are there other areas that you are planning to include for internship possibilities?
It's all inclusive. So we would look for internships for any of our departments. So from practice, education, licensure, depending on what the individual's area of education is, we would, invite them to different areas. We just had a school reach out to us for the one that we have in investigations. And then the high school student was somebody that I knew, and that was a new ground for us to kind of test to see how that would work out. It worked out phenomenal. So I think we may have a budding relationship with this high school that we may be able to get future students for that high school perspective. I mean, understanding that we're exposing that high school student to a lot of different things that they may not see in our regular opportunity. So this student had the opportunity to speak with individuals in the legal department, investigations, education, practice, licensure. So we really exposed him to a lot of different avenues to help blossom and make him think about what he may want to do in the future. So we're open to other opportunities from MSN students, PhD, DMP students. So we will start marketing that information. Part of his project from the high school student was to develop a brochure to highlight what the opportunities could be here at the Board of Nursing. If you know somebody that's interested, please do reach out to us and we can help work through that process of getting them in here for an internship.
Thank you.
And we were very lucky to, our first intern who we practiced on was Yusuf. And he was in the IT department and learned how the board protects its data, cybersecurity, how the board uses technology and regulation. And we were happy to hire him on as an employee. So yes, we're getting started and gaining ground and would love to hear from anyone interested in the program.
Thank you. That's a great opportunity. I know Yusuf, he should feel blessed because we have an awesome IT team here at the Board of Nursing. So great opportunities. Any other questions from the board members? Thank you for this report. And Dr. Griffith, do you want to stay and give your performance measure scorecard?
Yes,
And for the board members, that's M13.
Thank you for the opportunity to present more data to you regarding our nursing workforce and some other information about our organization. So I'm going to start here with our North Carolina available workforce for RN and LPNs. And I know you've heard a lot of different data from Dr. Tillman on her quarterly report. This information is on a fiscal year. You also heard information from SHIPS from data from 2022. So please understand that the numbers will look different on this report. So for our RN workforce, we have seen a phenomenal growth in the number of licensed RNs in North Carolina. From 2018 to 2024, we've seen a growth of estimated about 15,000 RNs in North Carolina. Our LPN population has dipped, but it seems to be coming back up as well. So in 2022, we had 22,512 licensed practical nurses licensed in North Carolina. And as of 2024, the end of the fiscal year, we had 22,674. This could be in relation to the funding for LPN programs as well as for baccalaureate programs receiving awards for or financial awards to increase the nursing workforce in North Carolina. As discussed earlier, related to our MP workforce, again, we've almost doubled the number of MPs that have an approval to practice in North Carolina since 2018. As of the end of the fiscal year of 2024, we had 14,502. Again, this data is also available on our website. So if you want up-to-date today's data, that data is available at the very bottom of our website. For our CRNA and CNS populations, for our CRNAs, we had a dip in the number of CRNAs with a recognition here in North Carolina in 2022 with 3,642. We did have an increase up to a little over 4,000 CRNAs by the end of the fiscal year of 2024. Our CNS population, our small but mighty group of CNSs, is starting to slowly grow. In 2018, we had 234, and as of the end of the fiscal year, we had 282 CNSs in North Carolina. So for our certified nurse midwife population, I want to highlight that there are two different categories here for our certified nurse midwives. We have an independent certified nurse midwife and a certified nurse midwife who has collaborative practice. So Senate Bill 20 sparked the opportunity for CNMs to have that opportunity to apply for independent practice. So as you can see on these two slides, we are seeing an increase in the number of CNMs with independent practice and a decline in the number of CNMs with collaborating providers. So the assumption is that these CNMs, once they reach that mark of having the clinical hours required, they are applying for that independent practice. I will also note that we have not received an increase in complaints for certified nurse midwives with independent practice. So for our nurse aide population, we are seeing an overall decline. This has been reported in the past. In 2020, we had about 15,500 NA2s in North Carolina, and they are down to a little over 10,000 at the end of 2024. We would have to analyze more of why this trend is happening and determine if they are staying the route of the NA1 certification. So for our nursing programs in North Carolina, we have 61 associate degree nursing programs. We have 50 practical nursing programs, diploma in nursing programs, and that's an increase of 5 programs for the practical nursing program since last fiscal year. And then we have 36 baccalaureate programs. So we have the programs in North Carolina to hopefully meet the needs of increasing our workforce. The trend with the initial capacity request has seen a decrease from data from 2019 to 2023. However, based on those grants and funds that I talked about earlier for BSN programs as well as the community college programs, there's been a substantial increase, that blue line, in the requests from programs to expand their program seats. The program expansion numbers from 2019 to 2023 was steady with no substantial increases except in 2021 with a slight decrease. But again, we're seeing that substantial growth with those funds that were offered to the BSN and community college programs. As talked about earlier, our licensure cycle times are phenomenal. You can see individuals that are applying for endorsement. It takes about a day to be endorsed into North Carolina. And that again is once all the information that is needed to process that application has been received. I will highlight the exam LPNs for non-US individuals with a cycle time of 172 days. That is mainly because those individuals are waiting for a social security number. So without that social security number, they cannot be licensed. So they've submitted everything, but they're just waiting for that social security number to be processed. For our licensure by exam section, we had 7,283 individuals that were licensed by exam. I will highlight that UNC took the lead of 216 individuals that were licensed by exam, with East Carolina taking second at 211. We shall see. Last year, East Carolina was at the top, so we shall see what that data looks like come next year. Our RN population is our largest group of nurses in North Carolina, as you can see with the first pie chart there on the top. And then the chart down the bottom is a breakdown by identified race. Now, I will highlight that these numbers may look different than the total number of 7,283, as this is an optional question on the application, so an individual does not have to answer that question. We are seeing an upward tick and an increase in diversity among our nursing population, so that is of great interest. We'll continue to monitor that. For licensure by endorsement, we had a little over 6,600 individuals that were licensed by endorsement into North Carolina. And this chart here highlights some of the states in which these individuals are endorsing from, with New York, again, being the highest state that individuals are endorsing into North Carolina. Our SANE program statistics, we had 6 new programs, which is an increase from 3 programs last year. So we're seeing an increase in the number of program applications for SANE programs. We had less programs that were closed. Last year, we had 9 programs that were closed. This fiscal year, we only had 1. And we have 15 active programs as of June 30th of 2024. And again, that's an increase from last year of only 12 SANE programs that were offered. Our complaint evaluation tool consultations from fiscal year, and these are the consultations offered by our practice department. So if there is a practice-related event at an agency can contact one of our 3 practice consultants and review that event with them to determine if that event needs to be reported to the board or if that's something that they can manage internally. What we did see is hot months are September, January, and April. Those are consistent from last year as well. Related to the number of complaint evaluation tool consultations that we had. So we might have to look into why that's consistently those months are higher than other months. So to talk about the management of our complaints, we had 993 cases that were created for investigation this past fiscal year. We had some cases of 531 that were accepted as information, and there's some other data on this slide as well. But this showcases the work of our investigative team as well, and the number and volume of cases that are being investigated. This is our cycle time for our investigative team. And as you can see, the largest case is our criminal charges and convictions. And with that, it took about 305 days in order to process a criminal case. And what we're doing is waiting on the criminal system to get through the process of the criminal case. So we're just following along until there's either a conviction or the individual is not convicted. The next highest number is for nurse practitioners for inappropriate prescribing at 203 days. And part of this could be related to joint regulation, in which we can complete an investigation, but then have to wait for our next meeting of the joint subpanel meeting in order to allow that case to be heard by that panel for a decision to be made. So one thing that I highlighted when I was at NCNA, which I think is very important, is that our investigations don't always result in discipline. There is a variety of options, and this is a very busy slide as well, a variety of options based on the evidence that is collected during the investigation to determine what shall happen with the nurse. So there's opportunities for cases to be closed with no further action. That means we found no violation of the Nursing Practice Act, letters of concern. We can do non-disciplinary consent orders, and that does find violation, but we do some remedial courses leading up to a suspension of the license for violations that are egregious enough that would warrant a suspension of a license. For our legal proceedings department, again, a very busy year for them as well. They had 51 cases come before the licensure review panel, 33 cases came before the settlement panels, 18 cases for hearing committee, and 12 for administrative hearings. Our compliance department is busy as well, monitoring individuals and various consent orders, from published orders to non-disciplinary consent orders, and the various programs that we offer, from probationary licenses to probationary licenses with drug screening and non-drug screening, and monitoring individuals in various courses that they must complete as well. And are there any questions? Thank you.
Thank you, Dr. Griffin. No questions from the board members. If it's okay, we'll take a quick 5-minute break. Is that okay with everybody? Okay. Okay, we will continue this time with the board business meeting for September the 26th, 2024. And at this time, the Governance and Finance Committee, I would like to recognize the following: the committee chair, Tom Minowitz, committee members, Dr. Laura Bartlett, Dr. Raquel Ingram, and me, Dr. LaDonna Thomas, and staff liaisons, Angela Ellis and Gail Bellamy. If you could, please approach the table. And I will have Tom Minowitz to take it away.
Thank you, Madam Chair. Thank you for introducing everybody as well. So we're going to look at M14, which I think is on page 50 of everybody's packet. This is in April 2024, the Governance and Finance Committee reviewed and approved a recommendation for draft language regarding board member conference attendance and presented it to the full board in May of 2024. After board discussion, the policy was tabled for further discussion, and the board directed the Governance and Finance Committee to review further and bring back a recommendation of the September 2024 board meeting, which is where we are now. At its August meeting, the committee reviewed the proposed policy language based on discussions from the May 2024 board meeting. Madam Chair, at this time, the committee recommends no conference attendance policy be implemented.
Thank you, Tom Minowitz. Any questions? And I do ask that if you have any questions, to please add any new contributions. We did have a robust conversation at our, I think, May meeting. So if you have any new information to provide, please do so. I think Dr. Steele.
Hey, Dr. Steele here. So I was not in attendance at the May meeting for family reasons. My question, but after reading the notes about the discussion, my question was, did the proposed discussion include going from 2 conferences per year to 2 conferences within a 4-year term? Because that's the way it reads. So I just wanted to ask that point of clarification because that's what's in the minutes.
Harris, would you like to address that? Put you on the spot.
Of course, thank you. I believe that was the discussion, but y'all correct me if I'm wrong. And there was a lot of discussion had amongst the board members, and so staff was directed to take it back with the committee. The committee met, and at this point, their recommendation is to basically table the discussion, not do anything.
Okay,
at
but
this time.
the proposed change was to go from essentially in a 4-year term, 8 conference potential opportunities to 2.
Yes.
Got it. Okay. I just wanted to make sure I understood that, and the words per year were not omitted from the minutes because I did not hear the discussion. Okay, thank you.
Thank you, Dr. Steele. Any other comments, discussions? Okay. This is a committee recommendation, so we do need a second. Do I have a second?
Don't need a second.
I'm sorry, we do not need a second. I'm sorry. I will call for the vote. All in favor with a show of hands. All right, and the motion carries. Mr. Minowitz.
Okay, so agenda item M17, which is nominating committee review. Again, this is on page 51. The Governance and Finance Committee is responsible for reviewing and nominating committee process. The committee reviewed, discussed, and amended the approved recommendation. Madam Chair, at this time, the committee recommends the dissolution of the nominating committee.
Thank you, Mr. Minowitz. I think it's M15 in your packet.
Correct.
Any discussions? Further discussions from the board members? Okay, this again is a committee recommendation. Do not need a second. So I will call for a vote. All in favor by a show of hands? Okay, and the motion carries. And we are M16, if you're following, the review of financials.
Yes,
Mr.
so
Minowitz?
now for the entertainment portion of our program. I know everybody loves these numbers. So agenda item M16, which is the review of financials. The committee reviewed the following financial statements: statement of net position, statement of revenue, expenditures, and changes in net position. The statement of net position summarizes the financial position as of June 30th, 2024. Assets totaled $29,745,358. Liabilities totaled $10,534,610, with a net position totaling of $29,210,548. The statement of revenue, expenditures, and changes in net position details how the financial positions changed during the fourth quarter of the fiscal year. So the revenue, which is operating revenue, totals $11,969,348, which was an increase of $402,711, or 3.5%. Non-operating revenue from investments totals $1,309,268, with the total revenue was $10,398,040. On the expenditure side, expenditures totaled $12,175,672, which an increase of $1,313,451, or 12.1% over the same period last year. The resultant net position is $1,308,711. Change in net position is the target performance measure is a positive change in net position, meaning there is cash available to grow the organization. For fiscal year 2023-2024, there was a 6.1% increase in net position. The operating revenue, also known as working capital, is a measure of how much cash is available to fund day-to-day operations. The target performance indicator is to maintain a cash flow reserve equal to 6 months of operations. For 2023-24, there was a 13.34 months of operations available. Debt to asset ratio is a solvency ratio that measures the board's ability to cover its financial obligations in the event of a business downturn. The target debt to asset ratio is less than or equal to 50%. For fiscal year 2023-24, debt to asset ratio was 35.42, which is obviously better than 50%. Liquidity, also known as a quick ratio, is a measure that shows whether or not the NCBON can pay its short-term obligations due within 1 year. The target liquidity ratio is 2-to-1 asset to liability. For fiscal year 2023-24, asset to liability ratio was 4.6-to-1. So again, another strong indicator. For fiscal year 2023-24, key financial indications were met and exceeded in all of the categories. Now, maybe the only person standing between us and lunch, oh, they're up here already, Wes and Jessica, from Wells Fargo Advisors, to go over the market analysis and investment performance reports.
Well, it's good to be with y'all, and we can make this as short as possible if we're the ones standing between lunch. But this might be the quickest update that we do. Jessica is going to cover the performance briefly, and then I will pick up with a market outlook.
Okay, so looking at the board's accounts at Wells Fargo Advisors, I like to first just give an overview. The stock account currently makes up about 34% of the entire portfolio, while the bond account makes up about 66%. So nice conservative posture there. The stock account through the end of July was up 5.9%. The bond account was up 2.76% through the end of July, bringing the total portfolio up about 3.8% through the end of July. I also like to give some performance numbers, and it's been an interesting year in the markets. I know I've said this probably for the last year and a half, because there's just a couple stocks that are doing really well. When we look at the S&P 500, that was up 16.7% over the same time frame, largely due to weight in certain stocks that are technology stocks that are a little bit more growthy, and the board doesn't necessarily have a large position in. So that's why the S&P 500 was up quite a bit, 16.7%. Dow Jones up about 9.5%. But when I look at a more accurate comparison, a blended stock index might be up closer to 11% through that same time frame. And the U.S. aggregate bond index through the end of July was up 1.6%. I did look just yesterday before we came. The board's accounts have really over the last 2 months come quite a bit. So the stock account through the end of the day on Tuesday, the 24th, it was up 10.4%, the stock account. So it's had a really good just 2 months there. We've seen a kind of, Wes will talk about this, but a change in what is performing well within the stock market. Bond account up 5.2 through Tuesday. So the whole portfolio up about just under 7%. And I'll pause for any questions and then let Wes take over for looking at the markets. Anything?
So we wanted to talk about recent performance because just like Jessica said, there's a pretty broad shift that's taken place in the markets from, technology has led the way for really the last 2 years, technology sector, and is shifting to where the market is broadening out and other sectors are participating. Like this year, we have utility stocks are one of the best performing sectors, and financials. So, and the reason why, as y'all may be aware, the Fed cut interest rates by 50 basis points last week. That's 0.5%. And that's the beginning of a series of Fed rate cuts that we think will continue into the first quarter of 2025 or in the spring of 2025. So I think we'll get additional cuts at the November meeting and the December meeting, and then on into the first quarter of next year. So that's supportive to economic growth and stock and bond prices. That's a very good backdrop. That's, the one thing I want to, as we enter in a season of uncertainty with the election and everything going on in the world, I just would say the backdrop long term is very favorable. It's just the short term where we have a little bit of concern. There could be some volatility. And one of the reasons the Fed cuts rates is because they can do that because the economy is showing signs of weakness. Inflation's coming down. We're close to the 2% target. So it is possible that we see some volatility with that and the uncertainty that the election brings. But longer term, the backdrop is very favorable for the financial markets. We recognize when Jessica went through the performance numbers that, really through the first half of the year, we were trailing the market some because of that surge in technology stocks. We're closing the gap now. Like Jessica said, the stock account up 10% through Tuesday. The reason for that is we are more diversified than the market. The S&P is focused on technology, dominates that index. We're broader based investment, and we are going to be in those other areas like financials and utilities, which now are showing a lot of strength. So this is really what we're seeing is very favorable to where we're positioned now. And I would expect that trend to continue for the next several years as we go from an economy where the Fed was raising rates to one where now they start stepping down and cutting rates. So we feel good about where we are. I would expect us to be more in line with some of the major market indices and our benchmarks as we go forward. Just looking through my notes, I would just say, we're very constructive over the long term, just a little uncertainty over the next couple of months. So I'll pause there. I don't want to drag out this update and let y'all be late on your lunch. So.
Every time you come here in the last several months, you always kind of say there's a possibility of a recession. How do you feel about that at this time?
That's a great question. And one I would have asked if I was in your shoes. I probably should have mentioned this. So thanks for asking this. There's always a chance of a recession when the Fed is cutting rates, and they're doing this because they are seeing signs of weakness in the economy. The big question is have they waited too late to cut rates? So it is possible that we have a recession. Definitely, we're expecting a mild slowdown, but what Wells Fargo is predicting now is that soft landing where the economy slows, but it doesn't go into a full-blown recession. It's just a mild slowdown, and they softly land the plane, and they're able to, they're cutting rates, and the economy slows just enough, and then it picks back up again going into 2025. I will personally say in my 26 years as a financial advisor, I have never witnessed a soft landing, but it appears that they are pulling it off this time. And so personally, I'm kind of like, you got to, I'm skeptical in some ways, but when you look at the data, it really appears like they are pulling off a soft landing. Either way, I think if we have a recession or not, or even just a mild slowdown, the saving grace is that the interest rate cuts going into 2025 are going to support economic growth. And even if we have a recession, we should come out of it pretty quickly. So it wouldn't be anything like what we've seen in some of the prior recessions where it was very sharp and deep and nasty. So hopefully that answers your question.
Yes, sir.
The questions? Thank you.
Thank y'all.
Thanks for
Appreciate
having
it.
us. Hope you have a good lunch.
Stay and join us. Okay, so we will move along to agenda item M17, which is fiscal policy review. As a quality initiative, the Governance and Finance Committee reviews fiscal policies. The committee reviewed and approved the proposed revisions to fiscal policy F02 budget and financial review. Madam Chair, at this time, the committee recommends the approval of proposed revisions to fiscal policy F02 budget and financial review as presented.
Thank you, Mr. Minowitz. Any further discussion? All right, this is a committee recommendation. We do not need a second. So I will call for the vote. All in favor by a show of hands. And the motion carries. Thank you, Mr. Minowitz. As a reminder, before we move on to education, thank you, Ms. Bellamy. As we move on to the education component, please vote. Your link was sent to your emails, but please, if you have not voted, please vote. Take the time to vote. Now I would recognize M18, Education Program Activity, and recognize Dr. Terry Ward.
Madam Chair, members of the board, I am bringing to you a new program as stated by Dr. Tillman earlier, effective March 1st, 2024. The definitions in Rule 120, NCAC 36-120 was amended to include the program type of direct master's entry. The DME is going to provide additional education for strengthened competencies in organizational and system thinking, quality improvement and safety care coordination, interprofessional communication, team-based care, and leadership for students with a non-nursing baccalaureate degree. The DM program is generally presented using 4 variables of nursing education. They include curriculum, credit hours, area of study, and progression. And special attention were given to these variables and review of the DME applications received by the Education Department. Today, joining me from the University of North Carolina at Greensboro, I have Dr. Deborah Barksdale, the Dean of the program, and Dr. Yvonne Eves, the Senior Associate Dean for Academic Affairs. The North Carolina Board of Nursing received an application from Dr. Barksdale, Program Director and Dean of the University of North Carolina at Greensboro, to establish a DME nursing program. The application was received on June 3rd, 2024, and included information supporting the program's establishment. The proposed program is a pre-licensure entry-level master's degree program and will be titled the Pre-Licensure Entry-Level Masters of Science in Nursing Program. The focus of study will prepare students as nurse generalists who are registered nurses with entry-level professional nursing competencies and strengthen competencies in organizational and systems thinking, quality improvement, safety care coordination, interpersonal communication, team-based care, and leadership. The program will require 73 total credits, 56 in the BSN core and 16 in the MSN or master's core to be completed across 6 semesters, including 2 summer sessions. The maximum total enrollment requested by the program is 100 students. The proposed enrollment of the first cohort will begin in January of 2025. The cohort is expected to graduate in the fall of 2026. The proposed program will be physically located at UNCG in Greensboro, North Carolina. The application demonstrates evidence of the proposed student population, projected student enrollment, evidence of learning resources to implement and maintain the program, and financial resources adequate to begin and maintain the program. The current physical facilities adequately support the program's needs for students and faculty. UNCG has the authority for degree granting from SACS, the Board of Trustees at UNCG, and the program is approved by the Graduate School of the university. The program has other nursing programs. UNCG currently has a Bachelor of Science in Nursing program, which it has full approval status. The current enrollment for the BSN program is 271 students, and the current NCLEX pass rate is 96%. There are sufficient clinical resources and agencies available for utilization for the program. An initial site survey was conducted on June 13, 2024. Current facilities and plans for enrollment and capacity are sufficient. There were no recommendations as a result of the initial survey. The recommended board action at this time is that UNCG at Greensboro be granted initial approval for the DME program with a maximum total enrollment of 100 students to begin in January of 2025.
Thank you, Dr. Ward. Do you have anything to add? Dr. Barksdale?
Thank you, Board, for receiving and hearing our application. We are quite committed to the success of this program, but not just the success of the program, but to helping to alleviate the nursing workforce shortage here in North Carolina, and particularly in the Triad area. We know that we have the adequate resources, faculty, clinical partners, and everything else to make this a success. So thank you.
Thank you. Any further discussion? Dr. Steele?
I just want to commend you for taking the initiative to establish this program and to what I believe further diversify the nursing profession. So thank you for doing this.
Dr. Ingram?
So I commend you as well on your innovation. I do have a few questions for clarity. So the 73 total credits does not, or I should make it a question, does that include the gen ed, the required gen ed?
Well, generally, students that, I'm going to use transfer loosely, are not held to the same gen ed standards. But with that said, there are prerequisites that these students will need to come into this program as well.
Yes.
Dr. Ingram, the total credits I presented are nursing credits.
Okay.
56 in the BSN core and 16 in the master's core.
Thank you, Dr. Ward, and thank you, Dr. Barksdale. My next question is with the prereqs that you mentioned, Dr. Barksdale. Will the students be required to complete those prereqs prior to applying to the program? So, for instance, like the anatomy and physiology, because these are second degree students, applicants.
Yes, I'll let my associate dean speak specifically to that, but yes, we anticipate that.
Yes, they do have to complete the prerequisite courses, just like students coming into our pre-licensure BSN, mostly science courses. And they have to complete most of them before they come into. We generally sometimes allow students to be lacking one or two of the prerequisites when we let them in our traditional BSN program.
Thank you. My last question is, do you plan to continue with your traditional pre-licensure program?
Absolutely.
Thank you. Again, I commend you on your innovation.
Absolutely, I commend you as well on the DME program. Any other discussion before we? All right. Do I have a motion to approve staff's recommendation? All right. Dr. Cheryl Wheeler made the motion. I think I saw Dr. Ingram's hand, so I will take that as a second. I will now call for a vote. All in favor by a show of hands. And the motion carries. Congratulations. Thank you.
Madam Chair, members of the board, I bring to you Duke University School of Nursing. Joining me are Dr. Michael Ruff, who is the Dean of the School of Nursing, and Dr. Ann Derwin, who is the VP of Academic and Student Affairs. In the audience is Dr. Deborah Mattias, the Director of Academic Support Operations. The North Carolina Board of Nursing received an application from Stephanie Getsky-Neiman, Program Director of the Duke University School of Nursing, to establish a DME nursing program. The application was received on June 28, 2024, and included information supporting the program's establishment. The proposed program is a pre-licensure entry-level master's degree program. The proposed program prepares a practice-ready generalist. The curriculum was intentionally built to support student transition into advanced practice academic programs which exist at the university. The program requires 63 credits total, 51 in the BSN Nursing Core and 12 in the MSN Nursing Core to be completed across 4 continuous semesters. The maximum total enrollment required by the program is 270 students. The proposed enrollment of the first cohort will begin in August of 2025. The cohort is expected to graduate in December of 2026. The proposed program will be physically located at Duke University in Durham, North Carolina. The application demonstrates evidence of the proposed student population, projected student enrollment, evidence of learning resources to implement and maintain the program, and financial resources adequate to begin and maintain the program. The current physical facilities adequately support the program's needs for students and faculty. Duke University has degree granting privileges from SACS, the Board of Trustees at the university, and the Duke Graduate School have approved this program. The status of other programs at the institution is as follows. Duke currently has an accelerated Bachelor's of Science in Nursing program with full approval status. The current enrollment for the BSN program is 245 students. The current NCLEX pass rate is 90%. And the application included a plan to teach out the entry option in spring of 2026. There is evidence of sufficient clinical agencies that have indicated applications with information concerning their clinical agency resources for the program at this time. Initial survey was conducted on July 18, 2024. Current facilities and plans for enrollment capacity are sufficient, and there were no recommendations as a result of the survey. The recommended board action at this time is that Duke University be granted initial approval status for the DME program with a maximum total enrollment of 270 students to begin January, spring of 2025.
Thank you, Dr. Ward.
I'm sorry, August. I apologize, August. I'm sorry, August 2025.
Okay. Thank you, Dr. Ward. Would you like to present?
Sure. My name is Michael Rolfe. Thank you for the opportunity to present our proposal to the Board of Nursing, and thank you to Dr. Ward for your thoughtful analysis. As Dr. Ward said, we will be sunsetting our baccalaureate, our accelerated BSN program, and begin the transition in fall of 2025. We are differentiating our master's program at Duke University School of Nursing, retaining the MSN for advanced practice, and this will be an MN degree, a Master's of Nursing, so the external community can differentiate our master's graduates from a generalist and an advanced practice provider. So thank you for the opportunity.
Any further discussion, Dr. Steele?
Yes. First of all, I want to commend you also for your application, but specifically for the clinical resources, I wanted to say great job in reaching out to community-based organizations for clinical resources, including Cura Americas Global, El Centro Hispano, the Housing Authority, Families Moving Forward, the Program for All-Inclusive Care for the Elderly, Project Access of Durham, Reality Ministries, and Urban Ministries. And that really says a lot about your desire to work within the community in addition to the standard clinical agencies such as the hospital and some of the other more well-known. So thank you for that.
I commend you as well. Dr. Ingram?
And I commend you as well. For clarity, your accelerated, your ABSN program will be no longer.
Correct. When we matriculate the first group of students for this program in fall of 2025, the cohort that we have admitted our January 2025 ABSN cohort, they will be the last cohort admitted to that program, graduate 16 months later in May of 2026, and then that program will be sunset within the School of Nursing.
And will the didactics, is that online or will that be face-to-face?
That's a great question, and thank you. Most of the courses, all of the courses with a clinical component, a clinical management nursing practice component, will be taught face-to-face. Some of the courses, for example, Population Health in a Global Society, Nurses Scholar 1, Nurses Scholar 2, will be a hybrid online distance-based program, or course, sorry.
Awesome, thank you.
Any other discussions? Okay. Do I have a motion to approve staff's recommendation? All right, Dr. Lewis made the motion. Do I have a second? I saw Andrea Jepson's hand at second. I will now call for a vote. All in favor by a show of hands. And the motion carries. Congratulations. Thank you. Now we will have practice Dr. Joyce Winstead, Ms. Joyce Winstead to the table, please. And that's M19.
Thank you. So this is referring to M19 in your packet. So practice staff received questions about the licensure and scope of practice requirements for out-of-state nurses traveling in North Carolina with an assigned client. And some examples are the school nurses traveling in North Carolina with their students, educational students. Another example is the nurse transporting a patient from one facility to another facility that's crossing the state lines coming into North Carolina. And another are the nurses that accompany their patients on vacation. An example could be a New York nurse coming with their patient to the Outer Banks for the week. So currently, the position statement entitled out-of-state nurses practicing in North Carolina for a limited period of time permits all nurses traveling in North Carolina with an assigned client to practice without a North Carolina nursing license or a multi-state compact license. The North Carolina Nursing Practice Act requires the nurse to have an active license to practice in North Carolina. The Nurse Licensure Compact permits the nurse with a multi-state compact license to practice in another compact state without having to obtain a license. So to be consistent with both the North Carolina Nursing Practice Act and the Nurse Licensure Compact, the nurse must hold either a compact license in that nurse's primary state of residence, and that's a multi-state compact license in their state of residence, or a single state North Carolina license in order to provide services for a client located in North Carolina. So the nurse who holds a non-compact state license or a single state, out-of-state license in a compact state must obtain a license in North Carolina to provide those nursing services for the client located in North Carolina. Reformatting the position statement into a frequently asked question would provide that clarification for the out-of-state nurses and the employers regarding licensure and the scope of practice in North Carolina. So the recommendation is the board approve the deletion of the position statement out-of-state nurses practicing in North Carolina for a limited period of time.
Thank you, Ms. Winstead. Any discussions, Dr. Chris? Oh, any discussions? Do I have a motion to approve staff's recommendation? Dr. Amy Steele, thank you. Do I have a second? Ms. Jepson has seconded the motion. I will call for the vote. All in favor by a show of hands. All right, and the motion carries. Thank you, Ms. Winstead.
Thank you.
Moving along to NCAC Chapter 36, Administrative Code Rules. I recognize Angela Ellis and Ms. Meredith Paris.
Good afternoon. Y'all know I love a microphone. So we are going to undergo a periodic review as required by the legislature, but talking with Dr. Tillman and looking at what we have ahead of us, there were some rules that just needed our attention a little sooner than that. And two in particular would be 0211 licensure by examination and 0218 licensure by endorsement. We are going to take these individually, Madam Chair, for a vote because they're in different processes. I would refer you to the draft of these two revisions for 0211 and 0218 I worked with Tony Graham and Andrea Gunter, as well as Candace Moore in licensure to revise these rules. You'll see they are very extensive, and to spare some of the formatting headaches right now, what we did was basically make the licensure by examination process, we streamlined it. Ms. Ellis and I have been working with the Rules Review Commission extensively lately, and we're seeing a shift in how they would like to see the rules drafted. So we've taken their guidance and drafted these rules with this language in mind. So it doesn't change our requirements whatsoever. It just clarifies for our regulated public what they need to do and what needs to be provided. So that's why you'll see more detail, particularly with examination, the examination rule. You'll see it's a two-part rule as well, where you've got the authority to test, which we will do a preliminary review of their transcripts and their qualifications. But then after they pass the NCLEX, it still gives us the ability and the authority to do what we're supposed to do, and that's to determine their qualifications for licensure. We could address 0211.
0211, any discussions before we move on for a vote surrounding that? All right. Do I have a motion to approve staff's recommendation for 0211, Mr. Minowitz? Okay. Do I have a second? Dr. Ennis has seconded the motion. At this time, I will call for a vote for 0211. All in favor by show of hands? All right, and the motion carries. Ms. Paris or Ms. Ellis?
Thank you, Dr.
Thank you.
Thomas. I'm gonna take it again. So 0218, licensure by endorsement, again, worked with licensure department to work on these rules, and you'll see it's very extensive revisions, but it doesn't change the requirements. The necessity to go ahead and address this rule really came from the Operation Nightingale cases, and it's in line with the compact rules. You know, if we're going to endorse them, they still need to meet North Carolina requirements for licensure. This just clearly states that we have that authority to review them, and also lets our regulated public know what's expected of them if they're going to seek endorsement in North Carolina. I appreciate all the work from licensure. Thank you very much. And would ask that at this time you adopt the recommendation to revise these rules and proceed with rulemaking.
Thank you, Ms. Paris. Any discussion for 0218? Dr. Ingram.
Just a comment. I think it's excellent. Thank you.
Any other discussions? Do I have a motion to adopt staff's recommendations for 0218? All right, Ms. Layden has made the motion. Do I have a second? Ms. Wheeler has seconded the motion. I will now call for a vote. All in favor by show of hands? All right, and the motion carries. Ms. Paris?
Actually, I'm going to turn it over to Ms. Ellis now.
Ms. Ellis?
Thank you, Ms. Paris. And so thank you for the board for those votes. We'll start another process with rulemaking with those two. So before you are two additional rules for this afternoon. If you will recall, back in May, we presented .0810 and .0229 due to a petition for rulemaking. So every agency is required to have a rule in place that the public can request that we make rules. So these are two that are being petitioned for rulemaking. So these two rules, which I'll speak to together because they're in the same track in terms of rules, but we'll vote on them separately. These were both approved by you back in May. They were filed with the Office of Administrative Hearings to begin notice of text in June. They were filed in the NC Register July 1, 2024, and we notified our interested parties by the website, email, and social media. We held a public hearing on August 25th, 2024, and we did receive comments at that hearing. We also received during the comment period, which ended on August 30th, additional comments. You have those in your packet, and all are in favor of proceeding with these rules. So for today, staff is requesting that the board approve amendment to 21 NCAC 36.0810 Quality Assurance Standards for a collaborative practice agreement and direct staff to proceed with rulemaking.
Thank you. And do we have any discussions surrounding 21 NCAC 360810? Dr. Ingram?
I just have a comment, and maybe this is something that I can speak to my LPN peers offline. But I was just looking at the opposition to the rulemaking in terms of the LPN not having the requisite training or competency. And I just wondered, like, within our current rules, do LPNs have that? And I don't want to sound demeaning to, question your capability, but just in response to this comment, are there any additions to add to your purview, if you will, of your pronouncing? Yeah.
In the facility I work at, we currently do not do it, and I think I can probably speak for the other ones. I think this is going to be a facility-driven decision. So I feel like if they decide that they are wanting to allow us to start doing this, then there would be some education around it in that aspect.
Thank you.
So just to add a little bit more information about that. So to add a little more information, the board has had the position statement, it's actually titled Death, in place for a very long time that speaks to both the registered nurse and the LPN's ability to pronounce death. So that has been determined to be within the LPN scope for a very long time. And of course, with any other nursing activity, the nurse would need to have the appropriate education and training and validation of competency in order to perform it. So, good question.
Any further discussion? And that was 0229.
0810, please.
For the
question was
the question was
for-
02, the question was
Okay.
0229.
Pardon me, sorry.
But I think we were voting on 0810 first, but no, that's okay, that's okay. So 0810, do we have any other questions specifically for 0810? Okay. All right, do I have a motion to approve staff's recommendation for, oh, I'm sorry, I'm so sorry, yes. Yeah, what's your question? Oh, you were motioning, okay. Dr. Shaw has, you're ahead of me, thank you. Dr. Shaw has made the motion. Do I have a second? Dr. Ennis has seconded the motion for 0810. At this time, I will call for a vote. All in favor by a show of hands? Okay, the motion carries. Now for 0229, any further discussions for that? Dr. Ms. Ennis, yeah.
I'm sorry, I meant to include that 0229 determination of pronouncement of death is an adoption.
That's an adoption.
Yes.
Okay. Any questions? Further discussions? Do I have a motion to approve? Dr. Shaw, and I saw a second, Ms. Jepson. I will call for a vote. All in favor by a show of hands for adoption of 0229, and the motion carries. All right, thank you. So we do not have the results of the election of, I hope everyone has voted, had the chance to vote. So we will move on. We did, okay. So we'll get those results to you, but right now we're gonna move on to M22, presentation of resolutions and plaques by Dr. Crystal Tillman. And then we will come back to M21.
And I am waiting on Catherine Soderberg to come in and with the blacks. I am going to go ahead and read the resolution. In appreciation of Dr. LaDonna Thomas, Dr. Laura Bartlett, Dr. Amy Steele, Miss Diane Layden, and Dr. Edna Ennis. Whereas the North Carolina Board of Nursing is charged with the responsibility of regulating the practice of nursing in order to assure safe nursing care for the public. And whereas membership of the board reflects a commitment to the public and the profession and a willingness to provide leadership in nursing in North Carolina. And whereas board activities have required much time and energy from members, and whereas you have willingly and actively participated in numerous activities as a member of the board, therefore be it resolved that the North Carolina Board of Nursing recognize and express appreciation for the many contributions made by you and the leadership role you have provided to the North Carolina. And be it further resolved that a copy of this resolution be attached to the minutes of this meeting and a copy be given to you. So the Board of Nursing would like to recognize the board members whose term have ended at this time. And we'd like to recognize the following board members. First, Dr. LaDonna Thomas, 4 years. Next, Dr. Laura Bartlett, 4 years. Dr. Amy Steele, 4 years. Congratulations. Thank you. Yes. Miss Diane Layden, 4 years. Thank you. So thank you all for your service to the Board of Nursing. And now we're going to do, sorry, I was about to leave one off. Dr. Edna Ennis, 2 years and 5 months. And this is why I have Catherine and Chandra to keep me straight. So thank you. Okay, our presentation to the plaque for the chair. The Board of Nursing recognizes the chair of the board for her work during the current year. At this time, I'd like to recognize Dr. LaDonna Thomas for 1 year for 2024. Congratulations. And now the presentation to the plaque for the vice chair. The Board of Nursing would like to recognize the vice chair of the Board of Nursing for their work during the current year, 2024. At this time, I'd like to recognize Dr. Laura Bartlett for her year. Thank you all for your service.
Thank you, Dr. Tillman, and thank you to the board members who are going to remain on the board and the ones who are rotating off. We really appreciate your service. Before we move along to the results, I'm going to take a quick 5-minute break, and then we will come back and hear the results of the election. 5-minute break.
After we adjourn.
To a little.
At this time, we're at M21 before we adjourn, the results of the election of the officers. So the results are for Chair 2025, be Dr. Raquel Ingram. Congratulations. And the Vice Chair for 2025 will be Miss Arlene Imes. Congratulations. Congratulations all. At this time, there are no more discussions. I need a motion and a second for the meeting to adjourn. Do I have a motion? I saw Mr. Tom. I saw Mr. Tom Minowitz as a motion, and I saw Dr. Amy Steele as a second. All in favor by a show of hands. Thank you. All right. Motion carries. The meeting is adjourned. Thank you. Yes, ma'am.